Welcome all to the fourth instalment of the lab seminar series for exercise health and physiology. And in this one, this lab we ran a series of cardiopulmonary exercise tests. So this was us actually using the breath-by-breath gas analyzers. And I just put this picture up here of me from many moons ago of actually conducting one of these tests on myself, just to show you that I've done it as well. So what we're going to do in this session is basically go through the screen that you would see on the computer and how to sort of run the software, and then what some of the things mean. Right, so the first thing you're going to get is this opening screen where you get to either choose a previous participant or you get to select to use a new participant. So at the moment I was on test 1. That was a previous test that I conducted on Matt, and if I wanted to I could conduct another test on him by clicking that button and then taking it through into the next setting, which is what I've done here. So now in this particular screen, because I've already selected my participant and I've already selected the test that I want to run, so that's CPET 1. Now in this stage all I need to do is really to calibrate the machine and then decide what test I want to run. So the beauty of this piece of kit is that if you want to, you can connect the software up to different types of ergometer. So you can do a cycling ergometer or a running ergometer, or presumably a cross-country skiing ergometer if they've got one. Now for us, we want to do a cycling trial, and so that's what we'd look to select. So we can see that's what I've done here. I've gone onto this screen and selected to do a Lodi Excalibur Sport bike. And all I'm doing in this part here is just making sure that the software is talking to all the different pieces of kit that I need it to. So you can see it's talking to the Metalizer, which is the breath-by-breath gas analyzer, the bike, the Lodi Excalibur Sport, and then also the heart rate monitor. And so once I know it's talking to all of these things correctly, then I'm happy that it's going to run these machines, and therefore I won't have to collect information on them separately. And essentially what's happening here is I'm just testing to see whether it's picking up this port or not, and it's saying that it's not, and you can't see this, but in the background I'm changing over leads and things to make sure that it's going to come up green essentially and say that it's going to run the bike for me. And it's done that now. So I'm just waiting for it to just confirm that it's picked up the bike, and then I'm going to move on to the next thing. Just while whatever I'm doing here, fiddling about sort of changing leads over, it's just important to kind of note that when you're doing this type of stuff, the whole point of doing using a breath-by-breath analyzer, or one of the points, is the fact that it makes life a lot easier. So rather than what you would normally do in a lab where you would sort of be putting weights on a bike and then you'd be writing down heart rate measurements and maybe some other bits and pieces. The whole point of this is that you get this part right, because this is going to coordinate the whole test for you. So this is going to allow us to press a button. It's going to be collecting breath-by-breath gas analysis data, so oxygen consumption, ventilation. It's going to be running the bike, so it's going to be increasing the load on the bike automatically without me doing anything, and it's going to be automatically picking up information from other sensors such as a heart rate monitor and kind of saving that data again, like on a breath-by-breath basis. So it's worth being aware of this sort of side of things, because this is kind of the important setup phase, which allows us to be able to sort of relax when we're actually taking the measurement and be able to kind of just concentrate on talking to our participant and looking at the test and seeing what's going on. Alright, so finally I've managed to figure out what was going on there, and then I can move now into the sort of like next phase really. Right, so what I've opened up here is, now we've told the machine that the bike is going to run the test, we need to set the particular protocol that we're interested in. So for us, we did this protocol where it's a 3-minute of rest, 3-minute of unloaded cycling, and then we have an exercise ramp which starts at 0 watts and increases indefinitely at a rate which you determine depending on the participant's size, fitness and things like that. And then we click them through into a recovery phase. And then once we're happy with that, presuming that you've already calibrated the machine, which we'll talk about in the labs, then this is the opening screen to collect the data. And so simply, once we've gone through that phase of just selecting the type of test that we want to do, telling the person who the participant is, all we need to do now is press that play button in the top left hand corner, and then the device will start picking up and recording all those different variables. So it takes a couple of seconds just to start picking up the data, so 3 or 4 breaths, and then hopefully you're going to start seeing that come up on the right hand side. So just to say what we've got here on this screen, it's what's known as a 9-panel plot. And essentially the 9 panels are just different ways of representing the core pieces of information that the machine collects. So it's just represented in lots of different ways. So essentially here we've got VE, which you can see in the top left hand figure, against VT, which is tidal volume, so how deep you take each breath. In the next one it's got heart rate and a thing called oxygen pulse, which is a kind of proxy marker of stroke volume. And then in the next one across, so the third one, so the one to the far right, that's going to look at oxygen consumption and CO2 production during the exercise. And then we look to sort of see the relationship they have to work rate. If we go down to the middle left hand side one, that's the VEV CO2 slope, which is an important variable in an exercise test. It tells you the kind of how efficiently you're able to clear CO2 via your increase in ventilation. In the middle, it's a V slope, so it's a plot of oxygen consumption against CO2 output. The next one across, which is VEVO2 and VEVCO2 over time, they're called ventilatory equivalents, and they're interesting markers again of respiratory efficiency. And we're on the bottom left hand panel, that is VT against VE again, and what this is going to show you is the pattern of increase in respiration, so how we increase VE, whether it's due to increases in the depth of breath or the increase in the frequency of breaths. And what you're going to see is a kind of particular pattern that you get during exercise, which I'll talk about in a minute. Then we've got RER, so respiratory exchange ratio over time, and what we're going to see with that is, it's kind of common, you'll see that it starts to increase during exercise as we start to first off use more carbohydrates for our energy source, but then because we start to sort of use anaerobic respiration to contribute to our ATP resynthesis, you start to get an inflection in that as well. And then finally you have these things called end-tidal gases, so partial pressures of end-tidal O2 and partial pressure of end-tidal CO2, and that's essentially the pressure of gases at the end of a breath, so at the end of an exhalation, which kind of gives you a bit of an indication about what's going on at an arterial level. Right, so you can see that I've sort of clicked the button now and it's started to pick up some values, and then what you're going to see is that the values on the right hand side come up, and then also you're going to see these points start to appear on the different figures, and they all coordinate to the same sort of point in time. And now what I'm doing is I'm going to alter how the screen looks, just to give me a bit of additional information. So what you can see here is I've added on time. Now that's useful obviously for being able to run a test so that you can be telling your participant where they're up to. So in the minute, the first 3 minutes is going to be a resting period, so I'll just be explaining the test to them, telling them that they're going to be doing 3 minutes of rest, 3 minutes of unloaded cycling, and they're going to hit this ramp that seems like a hill that gets steeper and steeper and steeper, and that the expectation is that they go for as long as they possibly can. I'll also tell them here that it's important that they don't talk during the test because it's going to influence the values that I see, and that the main thing is that they just kind of only speak to me if there's something really important that they need to tell me. And I also kind of at this point just make it clear that they just keep on going until they think that their legs can't go any longer, and that they don't just stop because they hit a certain number or something like that. Now what we can see here is I'm kind of flitting around the different things. I'm going to show you a few different screens here. So If you want to, you can change the screen to a preset screen that you like to see. So sometimes this one's quite nice because you can kind of see the test progress, or you can see the test coming. And it also gives the values nice and large, so often good if you're going to be showing the participants what the values are and explaining it to them. I like the one that I showed you originally, so I'm going to go back to that one there. I think it tells you more information and sort of shows you some of the important elements of physiology that's changing during the test. So and essentially I'm just going through these different markers just to show you how much you can kind of really do with the software. So there are different measurements that you can take. You can get it to record ECG if you've got the correct hardware. You can get it to do flow volume loops if you want to, if you're interested in respiratory mechanics. There's loads of different bits and pieces, and it kind of the more you sort of get into the software, the more you explore, I suppose, but we don't need most of these things. And then what I'm showing you here as well is something that's fairly simple, but it's quite nice to have, and that is that if you're interested in sort of taking RP measurements or SpO2, so peripheral oxygen saturation, which we are, that you can kind of record them on a different device and then input them here and set them. And then that will store on the computer those values at that point in time, which just allows you to sort of keep everything in one place rather than having sheets of paper that are that you're writing certain values on and then trying to sort of like bring them together afterwards. You can kind of keep it all in one place, and so it makes it a little bit easier to kind of look after and use effectively. So now I'm going over to the grey bar on the right hand side again. I'm just going to add back in time like I did before, and now I'll be telling my participant that it's time to start cycling. And what I ask them to do is that they cycle between 60 and 70 revs per minute, and that's simply because it's a reasonable pace to maintain, and it's the rate that we use for our patients during the testing. However many years ago when I did it, so they're asked to maintain that rate. And then now I'm going up and I'm looking at whether I can put some other variables that might be of interest to me. So you can see where the sort of marker is at the minute. It's on a thing called percentage VO2 peak. Now I'm not interested in that, but along there's going to be some other variables that crop up that I am interested in. So one of the things that I like to see is I like to have work rate in the top right hand panel, and it's just so I can kind of match up the change in work rate to the change in oxygen consumption and CO2 output. So that's one of the things that we got the groups to do in the session, just so they can kind of see this linear relationship that I've been talking about for weeks between these variables. And here I'm just showing you kind of how you can make some of the figures big if you really want to kind of explore something. So you can kind of see it's a half screen there, and so you can maybe make see the patterns of change a little bit more, and now it's a full screen. I don't tend to do that too much during the test, but I've done it a few times in this just to kind of explain a few bits and pieces to you. And I suppose what we've got here is something simple, but that you've got a resting oxygen consumption which sits in and around about 0.3, 0.4, with some variation, just because it's breath by breath data. And then at the 3 minutes, if you remember, we've got them to start doing some unloaded cycling. Now we can see that those numbers have increased a little bit to more like 0.5, 0.6. And they're reasonable, maybe even 0.7, and they're reasonable values for unloaded cycling. There's still an amount of work that's required just turning your legs over even against no resistance, and that's what's being reflected here. So if you think about it, you turn your legs around, you still need more ATP in order to do that. So in order to resynthesize that ATP, we're still going to need a little bit more oxygen, and that's what you can see. Something also to note here, just why it's sort of like getting through to the 6 minute mark, is just look at the relationship between oxygen consumption and CO2 output. Like you can see that one sits underneath the other, but essentially as one changes, the other one changes as well. And this is obviously because that's what's happening to the oxygen, is that you're turning most of it into CO2. So as we use oxygen, we're producing CO2 by a fairly equivalent amount. Like it's offset by a certain degree, but it's largely the same. Right, and what we can see now is that we're coming towards the 6 minute mark, so I'll just be telling Matt, I'll say, no, now the workload is going to start to increase on the bike. You'll not feel anything for the first 2 or 3 minutes, and then you'll start to feel kind of a moderate intensity exercise, and then towards the last 2, maybe 3 minutes, you'll start to feel quite difficult exercise, but it's important you just push through because it's a max test, and so we're interested in your values when you're not able to cycle any longer. And then now he's going to start cycling, he's going to start turning the pedals round. Now what we're going to see over the next few minutes with all of these variables is that there's going to be a little bit of a delay in most of them, and then they're going to start increasing up with this ramp. So the next minute really you can't read too much into it because there's all this delay, but then it's going to start to increase. And I suppose a few things maybe to note is that, if we look over at the VE panel, so the far left hand side, what we can see is that VE was sitting in around between 10 and 15 litres per minute at rest, and as he started doing the unloaded cycling, it's kind of sitting just below 25, so somewhere between 20 and 25. And again, these are reasonable values that you'd expect, and then now we're going to start to see this increase. What's also quite interesting is if you look at the bottom left hand panel, which is this plot of tidal volume against VE, what we can see is that in order to increase his ventilation, his VE, in this early phase of exercise, he's achieving it largely by increasing his tidal volume, so breathing deeper. So that's often what you see when people start exercising. They don't initially start breathing much faster, they just take deeper breaths. And we're going to see how that profile changes a little bit during the exercise. So just to say, I did this test like a week ago on Matt, where I recorded the video, and so I'm trying to remember all the different reasons why I kind of flagged up some of these different screens. So if I'm a little bit off point with some of it, that's the reason why. So this isn't really showing us very much at the moment. This is the lag really. It's not really into the kind of linear phase yet. I mean, from another point of view, if you look at the RER, which is the bottom middle chart, what you'll see is that RER at rest is sitting at about 0.8 to 0.9, which is normal during rest and unloaded cycling. So in moderate intensity exercises, you can use RER to give you an indication of substrate utilization, and so that's kind of indicating that substrate utilization is pretty much 50-50 between fats and carbohydrates. As we start to go through the test and it becomes more intense, then those kind of calculations kind of go out the window a little bit. Okay, so we can start to see this idea of like a linear relationship. So if we look at, the green line, which is work rate, and we can sort of see that slope slowly increasing, and then we can start to see oxygen consumption in the blue kind of increasing in a similar way, and then also, as I said before, CO2 slightly offset, so slightly lower, but kind of matching that same profile. And this is what I was really talking a lot about in the lab, to just try and get this kind of concept through to you, that certainly in moderate intensity exercise, that this relationship holds fast. So if you follow it through and think about it like logically, what's happening here is we're saying like we need to do more work, we need to produce more work, in order to move these pedals around. And so in order to do that extra work, we need to increase our ATP resynthesis, which we don't measure but we know is the case. And then in order to increase that, we need to increase our oxygen consumption. And you can just kind of see this profile. And so on this one here, we're looking at heart rate. We can see heart rate starting to increase as exercise intensity does, so that's the one in the brown. And then we can also see this really shaky one in green, which is this oxygen pulse, which kind of gives us a bit of an indication about stroke volume. So what it's sort of saying is that, early on in exercise, we're starting to increase our cardiac output due to an increase in heart rate and an increase in our stroke volume. Now the next one along, this is a ventilatory sort of chart, if you like. So what we're looking at here, really we're just interested in the one in the brown that's at the bottom, which is the ventilation. And so what we've seen here is just what I just explained. So, about 10 to 15 at rest, just under 25 unloaded cycling, and now it's going to start increasing as intensity starts to increase. So I've gone back to that plot that I said before. So this, looking at VE along the X, VT along the Y, and it just showing us that to increase VE, we're doing it through a combination of increasing our breathing frequency, but also and largely due to an increase in our tidal volume, so the depth of our breath. And what you're going to see is that starts to continue to happen until we almost hit a point at which we don't really increase our tidal volume anymore, and we only increase our VE by increasing our breathing frequency. Okay, so then this is that RER again that I just talked about. So we can kind of see it's not the nicest plot in the world, it's going a bit up and a bit down, but it's sort of sitting in around about 8 or 9, which is 0.8 or 0.9, which is completely reasonable for rest and low level exercise. And then now I'm taking you back to this block so just you can see what I've just tried to explain in a little bit more detail. So this relationship, linear relationship between increasing work rate in green, increasing oxygen consumption in blue, and then an increase in CO2 output in red. And so the order is this: we need to do more work rate in green, we need more ATP, which we don't measure. In order to get more ATP, we need to resynthesize it using more oxygen, which is the blue. Because aerobic respiration is part of the process is converting oxygen to CO2, we also increase CO2 in a fairly linear fashion as well. And then because we're increasing CO2, what we're going to see in a minute is that's going to drive our ventilation up. But this is heart rate. This is to show you that heart rate is doing the same thing. If we want to try and use more oxygen, we've got to deliver it through the blood. So in order to do that, we need to increase our cardiac output, and we're going to do that by increasing our stroke volume and our heart rate. And we can start to see that this is ventilation creeping up a little bit as well. Okay, I'm not entirely sure why I've gone to REI there. There's not really much of interest, but we're going to start to see that number increase because we're going to start to use more glycogen and glucose, or carbohydrates, for our energy source, and then we're also going to have a contribution of anaerobic respiration, which is going to shoot up our RER. But you can't really see too much of that at the minute, so I'm not really sure I've clicked on it. Right, this is just another way of representing this relationship of oxygen consumption and CO2. So you can see there's a kind of fairly linear relationship at moderate intensity exercise between the increase in VO2 and the increase in VCO2, which just is because they're related to one another. We're utilising oxygen, we're converting the majority of it into CO2, so as VO2 goes up, so does VCO2. And then what I can remember what happened here, I was trying to move this line that I just put on to try and show you this kind of linear relationship, and I couldn't get it to shift, so I'm going to mess about with it for a few minutes here until I realise that I can't do it. So everything that's going on now, all the flashing and that, just try and ignore it, it's not part of anything. Right, now this is the interesting one. So this is the follow-on to what I said before. So if we've got this increase in work rate, this increase in oxygen consumption, this increase in VCO2, then the next step is this here, which is this unbelievable linear relationship between the increase in CO2 that we produce and the increase in our ventilation. So look at how close to a line of one that would be. And what that shows you is that during exercise, the greatest driver of ventilation is nothing to do with oxygen consumption, and it's not directly related to the work that you're doing. It's related to how much CO2 that you're producing, and therefore what the CO2 levels are in the blood. So what's happening is your body saying, I can't allow CO2 to increase, and therefore I'm going to ventilate more to clear it. So that kind of almost completes to some extent that process of increased work, increased oxygen consumption, increased CO2, and therefore an increase in ventilation. And I highlight that quite a lot and have been doing in the lectures, because often it's a misconception with undergrad students where they think that an increase in oxygen consumption means an increase in ventilation, and it's really looking at it from completely the wrong point of view. The way you really want to think about it is to say, well, if we increase our oxygen consumption, that's going to cause an increase in CO2, which is therefore going to cause an increase in your ventilation. So it's not like a direct related cause and effect. So when you see an increase in oxygen consumption, you should be thinking an increase of work within the muscles, within the cells. That's what's driving the increase in oxygen consumption, and as a consequence of increased oxygen consumption, there's an increased CO2 output, which then causes you to ventilate more, not the other way around. Now I'm just showing you a plot here of these end-tidal oxygen, end-tidal CO2. The shape of the figures are not really important to you guys, so you'll see these variables crop up sometimes in the literature for heart failure and COPD. It's too complex to really go through what you're going to see in this short video, but essentially just understanding that it represents this kind of oxygen levels, if you like, oxygen pressures at the end of the breath. So when you're at maximum exhalation. which is important because it then starts to give you an indication of what's happening at an arterial and alveoli level, as opposed to kind of being a marker of just a combined breath, which has got, you know, some of the air which is only going to have ever entered the mouth, some of it is only going to have entered the sort of the large respiratory tract, and then some of it might have actually got as far as the alveoli and the small bronchioles, and therefore had a chance of participating in gas exchange. And we can see now that, like, Matt, when he's doing this test, he's starting to get there a little bit now. He'll start to feel it, you know, he's at sort of 200, 230 watts. We can see his ventilation's now up in its 50s, you know, so hopefully you're thinking to yourself, like, what would I expect, you know, somebody to get in an exercise test, and I give you that ballpark figure of 100, so we'll kind of see what Matt gets to here. Same for oxygen consumption. I'd love you to get in the habit of really thinking, you know, what do we expect to see in a kind of young, healthy male for oxygen consumption in litres per minute and then mils per kilogram per minute. I have an expectation in my head when I come into these tests, and I'm always looking to see whether they exceed my expectations or not, and then I can kind of use that to sort of start to think about how I can improve my idea of what I should expect in someone. And so when we were in the labs, there were largely what I thought, but there was a few people that kind of achieved a little bit more and a few people that achieved a little bit less. And we can start to see now, like, you know, there's multiple reasons why, but Matt's ventilation has increased quickly. So, you know, he's been fairly steady, and then all of a sudden he's started to increase it quite quickly, and that's because of an extra input of CO2 into the body through a bit of anaerobic respiration. Right, and I'm just highlighting this relationship again here. So look how straight that line is. So, you know, we're increasing our CO2, therefore we're increasing our ventilation. As he continues to do more work, he'll continue to produce more CO2, and then he'll continue to ventilate at a higher rate. And then almost heart rate kind of works in the opposite direction. Like, you know, in order to deliver the blood, in order to sort of, you know, increase our cardiac output, we need to increase our heart rate. And you can kind of see that progressing as he goes along. So there's almost like a sort of linear relationship between those things as well. So what's that? So it's over 80 litres per minute now. So again, you know, you should be thinking about what your predictions were for someone, young, healthy male. And now during the test, this is the point really where I'm focusing a little bit on the participant. Like, it's important to look at the numbers, and I'm interested in it, but I'm also interested in them and making sure that I'm encouraging them to try and sort of push themselves to get a really good test. The last thing you want is them get like a little bit distracted as they start to find it difficult. So it's really just about focusing on them, telling them about, you know, that they're doing well and that they need to kind of continue to push as hard as they can, and that there's probably only a few more minutes left, so just keep driving through, this sort of thing. Because one of the great things about using these pieces of kit is that I don't have to worry about this stuff getting collected. So, you know, I've not got to worry about turning a Douglas bag in or out, or remembering to take a heart rate measurement or anything like that. I'm just focusing on them and just pushing them so that I can get as best I can a maximal test that's going to be representative of their actual values. And if I remember right, Matt was kind of looking at me now because I told him he was only going to be doing like a fairly steady test, and I just kept him going until he started working pretty hard. So he wasn't particularly happy with me. And we're kind of coming towards the end now, so I can't quite remember how I finished this video, but I think the main things I just want to get over to you is for you to see the screen, kind of see how it works a little bit and how simple it is and how much it's done for you. And then there you go. So I've moved him into recovery there. So I'm not sure it was a full max test for Matt, because I said I tricked him into it a little bit, but you know, he was over 300 watts and he was getting there. He was working pretty hard by the end of it. And then now what we can do is all this data, every single time point for every single variable, is stored in the computer, and I can go back to it and I can look at it, I can change things, I can, you know, smooth things out if I want to, so I can sort of see things a little bit more clearly. But from your point of view, as your take home, if you look at some of the figures, well, his oxygen consumption was about 3.3 at peak. His maximum ventilation was in and around about 100 litres per minute. And so they're in and around the kind of values that I told you to kind of have as a real ballpark figure. But it's important that you put that into the context of that Matt is a 24-year-old, healthy, fit young man. And so if that isn't the case, then obviously you're going to need to shift your expectations accordingly. So let's I won't talk about the screen anymore. So that's really the end of the session. I hope you found it useful, and I hope you can get to one of the labs over the next sort of 2 sessions, just so you can kind of see this in practice and you can actually do these things yourself and realise how easy it is actually to do. Just to say, like, I gave one of these demonstrations to the group, and then they all went away and actually conducted their own tests themselves with pretty much no help from me. And so then hopefully in the next 2 weeks we're going to be doing the same thing to collect our data for our assessment. So that's really the point of lab session 5 and lab session 6 is going to be just letting you guys use this software, setting up your participants, and then looking and seeing how their physiology changes during the exercise test, and then hopefully making some predictions of what you're likely to see. So like I said, hopefully I'll see you in the next few weeks. If not, I'll post another session for next week to try and kind of follow up on this, maybe trying to look at how it might differ if you look at somebody with disease. So goodbye for now.